Hello, class, and welcome back to the second part of our lecture on affective disorders. So, we're going to just dive in now into a exploration of depression as a general kind of disorder. We're not going to look at the specific types of depression, but just more in a general sense. Now, depression is one of the most common types of disorders. Now, depression is a mental illness that affects a person's mood, their thoughts, and their behaviors. And it's characterized by feelings of sadness, hopelessness, and a lack of interest in activities that a person once enjoyed. Now, there are many different types of depression. There's major depression, there's persistent depression disorder, there's an older kind of disorder known as seasonal affective disorder. We don't consider it necessarily a disorder anymore, but just so you're aware that over time, different categories of depression get changed and adjusted as more research comes. But overall, depression can be caused, and it's well documented, but through a combination of genetic factors and environmental factors and psychological factors. In fact, a third of the population is significantly predisposed to developing depression by their 20s and 30s, and a third of the population is basically immune to developing depression. And that's mainly just based upon the genetic structure of different people. Now, there's some drawbacks and benefits of every kind of genetic structure. And so while some people may not develop depression, it also means that they are less sensitive to a lot of things in the environment, as far as, being able to read people and empathize with other people. So people that are prone to depression tend to have a natural tendency to empathize with others more, and so they're more caring individuals. So there's that side of it as well. Now, anxiety disorders as a group and affective disorders as a group of mental disorders are characterized by things like excessive fear and worry, and people with anxiety disorders in particular can experience intense, persistent feelings of fear and dread when there's no real threat. And so there's some common overlays between anxiety and depression. Things like anxiety disorder and panic disorder can really kind of disrupt the day. Now, what I want to focus on here is some clinical examples that illustrate the points of depression, and looking at why is it that people with depression experience sadness, loss of interest or pleasure in activities, and feelings of hopelessness or worthlessness. Now, some symptoms of depression can include things like, and remember, these aren't short-term, I feel this way for an hour kind of thing. These are the kinds of feelings that persist over time, weeks and months. So persistent sadness or anxiety or emptiness, persistent feelings of hopelessness or guilt or worthlessness, loss of interest in activities that a person once enjoyed. And this isn't a change in interest, this is a profound loss in doing some very common activities that you once enjoyed. Fatigue and decreased energy. Can't feel like you can't get out of bed for weeks on end. Difficulty concentrating or making decisions. This isn't brain fog for an hour, this is brain fog for a month or two. Insomnia or excessive sleeping, or changes in appetite or weight, or restlessness or irritability, or thoughts of suicide and death that persist. There are different types of anxiety: major depressive disorder, persistent depressive disorder, and seasonal affective disorder. What used to be seasonal affective disorder are some of the ones that people often have in mind. And some of the most common forms of depression are characterized by these symptoms, but lasting for at least 2 weeks. Now, the causes of depression are really complex. As I mentioned, there's some biological and genetic factors, but environmental factors can play into it, and environmental and psychological factors actually have a very strong, interesting interplay between the genetic factors and can influence the genetic factors and the expression of certain genes that define how your brain functions. And so early stressful environmental factors early on in life can have a profound effect later on in life over a period of time as it disrupts the balance of neurotransmitters such as serotonin and norepinephrine. So disruption in these systems, the serotonin and norepinephrine neurotransmitters, can contribute to the development of depression, as well as simply looking at a person's history, family history, things like having people in your family having history of depression tends to indicate that there's a genetic predisposition for it. Chronic stress can also disrupt this. As I mentioned, it can adjust the way genes function and the way your brain functions. Traumatic life events can also increase the risk of developing depression. Now, some treatments for depression: psychotherapy, talking things out, medication, ideally a combination of both. Now, psychotherapy, we will look at that more deeply. It's talk therapy. And this tends to involve working with a health professional to identify some underlying issues of depression and, again, to help practice adjusting the way that a person thinks when they're caught in that depressive state, as well as antidepressants. Those antidepressants that help to calm the centers of the brain that are saying there's danger out there, that there's risk out there. Anxiety and depression are very closely linked. And so we need to kind of keep in mind that what works for one disorder will tend to work with the other disorder as well. In fact, there's a great deal of comorbidity between anxiety and depression. If a person has anxiety, they have a higher likelihood of experiencing depression as well, and vice versa. If a person has depression, they have a higher likelihood of developing an anxiety disorder as well. So let's take a look at Maria. Maria is a late 20s lady who's experiencing symptoms of depression and has for the past 6 months. She reports feeling sadness and hopelessness and a feeling of emptiness. And she can't really identify the reason for these feelings, but she has difficulty even getting out of bed many mornings. She's gained a significant amount of weight, and she's lost interest in activities that she once enjoyed. She doesn't go out with her friends anymore, and she stopped exercising, and she has trouble sleeping. And she has a disruption in her appetite, and she has difficulty concentrating at work. And so she's had to take time off from work due to her symptoms. And Maria reports that she's even had thoughts of suicide. Although she hasn't made any plans that are specific, she has had these thoughts creep into her mind from time to time. And after a comprehensive evaluation, Maria is diagnosed with major depressive disorder, and she's put on a course of antidepressant medications under the direction of her medical professional, and she's directed to see a therapist to address some of the underlying causes of her depression. And over time, her symptoms improve. The antidepressants are working on helping her to feel safe. And the thinking therapy, the psychotherapy, is helping her to feel safe and to practice positive thoughts rather than negative thoughts. And over a period of months, again, this is not something that is instant. Antidepressant medications do not work instantly. They don't make you feel happy, but they provide a space for you to be able to generate happy thoughts. whereas depression kind of takes that ability away from you. And so over time, over months, she finds her symptoms lifting, and she's able to regain her previous functioning and get back to work and get healthy again and re-engage with her family and her friends. Now, depression is a common mental health condition, and it can have significant impact on a person's quality of life. And so it's important to seek professional help if you know someone that is experiencing the symptoms of depression. And it's appropriate to have both medical intervention as well as psychotherapeutic intervention for this. So just be mindful of all of that as we kind of go through. Now, what have we looked at overall in this lecture? Overall, we've looked at two mental disorders that are very common: depression and anxiety disorders. Depression is a mental illness that affects a person's mood, thoughts, behavior. They have feelings of sadness and hopelessness and a lack of interest in activities that are enjoyed by people. Depression can be caused by a combination of factors like environment, genetics, psychological factors, and then anxiety disorders are a group of mental health disorders that are characterized by excessive fear or worry. People with anxiety disorders can experience intense feelings of fear or dread, even when there's no threat present. And some common types of anxiety disorders are things like generalized anxiety disorder and panic disorder and social anxiety disorder and specific phobias. Now, anxiety disorders can also be caused by a combination of genetic, environmental, and psychological factors and tend to overlap with depression. A clinical case of depression that we discussed was Sarah. Sarah was that middle-aged lady that experienced feelings of sadness and hopelessness and fatigue for several months. She had trouble sleeping and had lost interest in usual activities, and she had difficulty concentrating and had overwhelming feelings of guilt and worthlessness that last for weeks on end. And she was diagnosed with depression. We also looked at John, a man in his 20s who experienced intense fears and panic over several months and was diagnosed with an anxiety disorder. He ended up being given a specific diagnosis of panic attacks, a panic disorder. And so he was, again, given a treatment plan of both therapy and medication. So, in essence, depression and anxiety are common mental illnesses. They tend to cluster around people that are very caring and sensitive. They tend to have a significant impact on a person's life. And so if you are a person in a helping profession, you're probably at a higher likelihood of having anxiety or depression, or experiencing it at some time in your lifetime, or having a close relative that experiences it in your lifetime, simply because of the way that you're made up. So while these two separate conditions exist, they do tend to occur together. So be mindful of that as well. And if you find yourself, or if you engage with people that are experiencing these symptoms, I do encourage you to engage in getting help, because there is good, clear treatments for these disorders that can help significantly. I hope you enjoyed this lecture. You take care, and I'll see you in our next topic. Goodbye.